Hello friends, welcome to Essential Med Shots. Today we are learning about antidepressant drugs. Depression is functionally linked with deficiency of monoamines like serotonin, noradrenaline in the brain. Antidepressant act by enhancing monoaminergic transmission and their clinical effects take 3 to 4 weeks to appear. Classification of antidepressants. Trick or mnemonic is double STMA. SSTMA. So first is selective serotonin reuptake inhibitors, serotonin noradrenaline reuptake inhibitors, tricyclic antidepressants, monoamine oxidase inhibitors. It can be reversible or irreversible. Atypical antidepressants. सेलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर्स, उसका जो नाम है उससे ही उसका मैकेनिज्म ऑफ एक्शन लिख सकते हैं. सिलेक्टिवली इनहिबिट द सेरोटोनिन ट्रांसपोर्टर एंड ब्लॉक्स द रीअपटेक ऑफ सेरोटोनिन इनटू द प्रीसाइनेप्टिक न्यूरॉन. They lack the anticholinergic and alpha blocking effects of TCAs. Therapeutic uses first line drug for major depressive disorders, generalized anxiety disorder, panic disorder, phobias, obsessive compulsive disorder, and post traumatic stress disorder. ADRs, gastrointestinal, can cause nausea and diarrhea, sexual dysfunction, loss of libido, and delayed ejaculation, most common reason for non compliance. Serotonin syndrome, dangerous hyperthermia, myoclonus, and rigidity. Mnemonic for SSRI side effect is also SSRI. So first S is stomach upset, which can cause nausea and diarrhea. Next S for sexual dysfunction, R for restlessness or insomnia, I for ideation, suicidal ideation risk in teens during initial weeks of therapy. Now, tricyclic antidepressants. So, tricyclic antidepressant will block three type of transporter and receptor. First is serotonin transporter, next is norepinephrine transporter and HAM receptors. Hence, it's called dirty drugs or dangerous drugs because it additionally block the muscarinic, alpha 1 adrenergic and histamine receptor, which can cause severe side effects. Uses. Now, second line for depression, mostly used for neuropathic pain, migraine prophylaxis, and nocturnal enuresis in children. Exemptric for TCA toxicity or TCA ADR, TCA toxicity, anti-HAM. H for histamine H1 block, sedation and weight gain. A for alpha 1 block, postural hypotension and dizziness. M for muscarinic block, dry mouth, blur vision, urinary retention, constipation, and tachycardia. TCA also block cardiac sodium channels, which can cause fatal arrhythmias in the case of overdose. Monoamine oxidase inhibitor. Monoamine oxidase is found in mitochondria, which is enzyme, mitochondrial enzyme. It degrades monoamines, cause intracellular accumulation of noradrenaline and 5-HT. Moclobemide is reversible inhibitor of monoamine oxidase A. The cheese reaction. If patient taking older non-selective monoamine oxidase inhibitors and then eats tyramine rich foods like cheese, red wine, yeast, etc. So the tyramine concentration in circulation will increase. So the tyramine enters in the circulation, which triggers noradrenaline release. It results in a fatal hypertensive crisis. Treatment is intravenous administration of phentolamine, which is alpha blocker. Serotonin noradrenaline reuptake inhibitor. Inhibit both serotonin and norepinephrine transporter but do not block HAM receptor. HAM receptor are blocked by TCAs, tricyclic antidepressants. Excellent for severe depression and neuropathic pain. Bupropion is a atypical antidepressant which inhibits the dopamine and noradrenaline release. Unique because it does not cause sexual dysfunction. Used heavily for smoking cessation. Another is mirtazapine, blocks alpha 2 autoreceptor, increase the noradrenaline and serotonin release, and block the 5-HT2 and 5-HT3 receptors. Causes significant weight gain and sedation, good for depressed patient with anorexia.